change my
Hey, I look dominant.
Uh-oh.
Also a dramatic effect.
You want the musical?
No, it's fine. We keep it on. Yeah. Is everyone finished? Good? Okay. So interesting, obviously most of you have been patients, and so I sort of actually know all of your health histories, which makes this lecture a lot easier. My goal with the presentation is to help inform you guys on what the root causes of back pain are. It's for sure one thing we're going to accomplish. And two, how many of you actually currently have back pain? Okay, so 3 people. Okay, so how many of you have had back pain more than 3 months? More than 6 months? More than a year? Okay. That helps. So the reason that's important is because chronic back pain is slightly different than something that you would get acute, like something that you just strain your back. And we're going to discuss so you can have a better understanding of what's the difference between something that you had for a long time versus something that you just kind of tweaked your back last week or last couple weeks. Right. So first is the root causes of back pain. Second would be what's the difference between acute back pain versus chronic back pain. And lastly, we're going to do some movement testing. We're going to look at what are some things that may be either actively in your body that you feel, or what I call hidden in your body that you don't realize that we can detect today, that if left unaddressed can continue your back pain. Okay? Right, so those are the 3 objectives. And so I know some of you have actually had physical therapy for your back pain. How many of you have not had physical therapy for your back pain? So everyone has had some physical therapy, right? Okay, so during that time, did your pain get relieved and it came back? Did it go away a little bit? How was the response? It's interactive, so you guys can answer questions. You can talk.
For me,
Yeah.
it slowly went away.
Okay.
And then it seemed to move to a different place.
Okay. So slowly went away and moved to a different place. Anyone else? Chrissy?
Mine, it definitely helped. Mine
Yep.
seems a little strange. It's
Okay.
It's not every day.
Okay.
If I sit too long, so I herniated 2 discs like 5 years ago, and that's when it started. Went through physical therapy, felt much better.
Got it.
Most days I'm not in pain.
Okay.
Some days I still have.
Moments. Okay.
My back's been good for like a year or 2.
Okay.
I haven't seen you, right? I haven't been in right there. Yeah.
That's a good thing.
If my back goes out, it goes out.
Sure. Right.
I didn't hear it.
And so just to paraphrase, your back typically is really good or really not good. Good. So it's really important to kind of understand these patterns, right? Because I want to talk about what they mean. Brenda?
Yeah, so that therapy really helps.
Mm-hmm.
And as long as I do my stretching every morning, I'm usually okay.
Okay.
Unless I have a day that I'm either sitting too long or
Okay.
standing too long.
Got it. And so just to paraphrase, so back pain was there, you had treatment, felt good, and as long you do your stuff, it feels good, but if you're sitting too much, then it kind of creeps back up. Okay, that's that pattern. Lou?
My problem is when I stand for a prolonged period of time,
Okay,
I sometimes really have difficulty to even walk.
got it.
I have to hold on. Or when I sit down, it does alleviate pain, but
Yeah,
it's a continuing problem. That's why I came here in the first place.
Sure. Yep. Right, so just to paraphrase the problem, whereas Brenda was, and Chrissy were sitting a lot increased the pain. For you, it's exactly the opposite, right? Where if you stood for a long time, that's where the pain gets really bad. And it's actually relieved when you sit, right? And so you can start to see some patterns, right? So for some people, standing a long time is tough. For some people, sitting a long time, it's tough. In general, if you have had physical therapy and you've been shown movements that are very helpful at alleviating the symptoms, if you don't keep up with them, it typically, you start to get the symptoms back, right? That's probably a pretty universal thing. And aside from that, then we have like Chuck's back, which seems to be really good, and then really, really not good.
These are reasonable if my back goes down.
Right.
So,
Yeah, something happens and your back goes out, right? And again, these are all so what I do all day for the last 16 years is look at these patterns and sort of analyze, well, what are the root causes of these patterns, and are there similar variables that contribute to people repeating some of these patterns, right? And so, because some of you, I'm sure, when you had your back pain, it wasn't the first episode. You probably can reflect back and be like, oh, there's been a pattern. And we've already identified some of these patterns, like sitting too much, standing too much, or nothing, do too much, and then boom, the back goes out. These are all, to me, patterns, right? Because it's not like the first time that you had it, like, oh, I didn't realize what just happened. It's more like it's happened and then went away, and it happened again, and went away, and it happened again. Right, and so one of the first things we can talk about, well, what are some root causes of back pain? And so I have a model here just to kind of go over the structure of the lower back, right? And so this is just the skeleton and the nerve and the discs of the back. There are, of course, ligaments and muscles and fascia, lots of stuff connected to the lower back, but this is just the skeleton, nerve, and discs. And so anatomically, this is the stomach and this is the back, right? So this would be like my lower back, right? The front part, and this would be like the back part, right? So we're gonna go with a side view. So when you're like 20, these discs, we can just imagine they're sort of really plumpy and extra thick, right? And so from lifelong of pressure, because we live on Earth and there's gravity, plus our world is poorly designed, right? So how many of you would wish or have an intention having better posture? Raise your hand. Right, so most people. And so I see that not as there's something wrong with everyone. I look at it as just a world around. I love how everyone just corrected their sitting, by the way. That was interesting, right? And so I look at it as because the world that's been designed around us is ancient, right? Like I always say, like it's the same chair and desk that Christopher Columbus had, right? It's thousands of years old. I'm sure we can go back. It's like the same desk and chair. So it's just been poorly designed. So everything that we do in our lives, sort of encourages our bodies to kind of go forward. And if you spend a lifetime of going forward and not much movement going back and other motions, your back will degenerate more. And we're going to talk about what are the two variables that contribute to this. So when you're 20, your discs are really pumpy, right? And so the hole, as you can see, the hole that the nerve goes through and the space between all the joints are quite large, right? But as you get older, the discs start to get less plumpy and less thick, and it gets thinner and thinner. And so what happens is this big bone gets closer to this big bone, the vertebrae. And so there are a few different effects of that. And so as this bone gets closer to this bone, there are these little joints on the side here. These joints were meant to help guide motion in your back, right? They help sort of guide how your back moves. They were not really meant to take on lots of pressure. However, as the disc gets thinner and thinner, those joints take on more and more pressure. And because they weren't really designed to take on a lot of pressure, they start to degenerate a lot faster, right? So some things happen if you've ever had MRIs. They'll say there's like bone spurring and sort of arthritic changes. It's what they're usually talking about is these joints here, right? So when they get bone spurs and they get deteriorative and they break down, those bone spurs can stick this way towards the nerve, and it makes the nerve irritated, right? And so if the nerve does get irritated, you can have pain going down into your leg, all the way down to your toes, right? It can go into your hip, groin, back of the leg, front of the leg, side of the leg, all the way down. It just depends on which level of the spine and which nerve is being irritated. And so science has mapped out, they know which specific nerve goes to which specific spots down your leg, right? That's why we usually tell, as a physical therapist, we tell patients that we rarely need an MRI, like a picture of your back, to understand, which part is being affected, because your pain area tells us which part, right? And so that's one aspect. As the disc gets thinner, the hole gets kind of small, and then you get enough arthritis where the nerve is irritated. Now, even if the nerve is not irritated, with enough arthritis, how many of you in the morning when you first wake up, the first 5-10 minutes, the back just feels more stiff and more sore? Like, raise your hands. Right. So most people above age 40-ish feels this, right? And so you're just basically feeling good old arthritis, right? And arthritis is a medical term they've labeled to describe wear and tear. That's all arthritis is, right? And so just from having 40 years plus of wear and tear, you're going to have arthritis, right? And what arthritis means is that the cartilage has become to be thinner and thinner, and when you're sleeping, you're not moving, right? Unless you're sleepwalking. If you take lots of possibly Ambien, you might sleepwalk, but if you're not doing that, you're probably mostly still. And because you're not moving, there's just lax circulation in your back. And so because it's not having good circulation, those inflammatory chemicals start to build up. And when you first wake up in the morning, all those inflammatory chemicals and all that additional pressure and fluid is what you're feeling. But after moving for 5, 10, 15 minutes, you get circulation back, it flushes the area out, and you feel better, right? So that's all that is in the morning. And so we've talked about, so the arthritis can give you some back pain. If the arthritis is severe enough, it can irritate the nerve. So another thing that could cause back pain is the disc itself, right? So you can imagine this disc would be like a delicious Boston cream donut, right? Good imagery right after some exercise classes. And so imagine if I have a Boston cream donut and I consistently push on the front of the Boston cream donut, where does that jelly or cream go? It goes away from the pressure, right? It goes back. If I push on the front, the cream is going to go back. And so that's what happens. So if you spend a lifetime, bending forward like this, or maybe you're sitting in a chair, instead of having your posture like this, you're kind of forward and you're leaning back with your lower back rounded. Maybe you're standing kind of bent forward doing some work activities. So a lifetime of bending forward, like how many of you do this? Let's just say how many of you do that prior to being in physical therapy? Because some of you may know that movement from physical therapy. But in life, when does life make us do this? Like never, right? And so if you spend a lifetime of bending forward, or the other way said is, if you spend a lifetime of pushing on the front of the jelly donut or Boston cream donut, name your favorite donut, the jelly is going to go out the other way, right? And so that's what happens is basically the disc bulges, right, back out this way onto the nerve. And if it bulges hard enough onto the nerve gets irritated, and then of course, same thing going down the leg, right? So imagine you could have someone that has the exact same symptoms. Let's just say numbness and pain on the thigh right here, right? So that would typically tell me the fourth nerve on the back has been irritated. Well, we need to figure out what's irritating the nerve. Is it the disc that's on it? Is it the arthritis, like the hole of the nerve has become too small? And this is where what we talked about, the patterns come in handy. Already just by hearing what patterns in terms of what positions tends to cause your back pain already gives us, as a physical therapist, a really big clue as to, is it the disc or is it the arthritis, right? And so, and later on we're going to do some movement testing, and on your sheet we'll sort of figure out if you're currently in pain, and some of you already know what the cause is, right? And so the workshop was designed for people that may not know. Some of you already know. And so those are some of the root structures. Now, there's another reason you may have back pain, right? So aside from arthritis, aside from the disc issues, you simply can just strain your back, right? And so you could go down and pick something and boom, no pain to extreme pain in your back, which is what Chuck described that you feel in your back, right? You can have this extreme pain. And so a sprained back is no different than, let's say, you sprain your ankle, right? And so essentially what happens is, like, if you sprain your ankle, you roll your ankle and ligaments are overstretched, and then the ankle blows up like a balloon the next day or two, and you have all that swelling and pressure. Well, that's exactly what happens inside your back. You just don't see, it's not like your stomach bulges out, right? Like, you just don't see it, but inside your back, all that stiffness and your inability to move and you're walking like this, it's because inside your back, boom, like lots of inflammation, right? And how does that happen? Well, if you're doing some type of activity and your back muscles are not working properly, and when I'll say your core muscles are not working properly, your core muscles are designed to brace your spine, right? So in your core muscles, basically every muscle from your neck down to your pelvis. Your core muscle isn't just your abs, it isn't just like your six-pack muscles, and it isn't just your obliques. It's not like your transverse abdominis, like they would say in probably Pilates and yoga. It's every muscle in your torso, right? It's your lats, your shoulders, your pecs, that's all part of your core. And so all those muscles in life should function to contract all at once, because if they didn't, and you went to pick something or you went to open a door, your spine, which normally should move as one unit, right? Bending forward, bending back, tilt to the side like this. It should move as one unit. If it doesn't work properly, either the timing of the muscles are off, the intensity of the muscles are off, because we take it for granted, like we just move, but hundreds of muscles are synchronizing with the right timing and the right intensity. If that's off, your back does this. Right, so I'll just kind of do that in slow motion. Ugh. Right, so it literally rips like this, And then there are ligaments there that gets overstretched, just like you roll an ankle, right? So the ligament goes like this, you tear a few fibers, so cells died, right? You tore it, and then inflammation comes, and inflammation is part of the healing process, right? So inflammation comes and gets rid of those dead cells to make room for healing tissues to come. But in that time frame, your back feels horrible. It feels very unstable. It feels like you really can't move. It feels locked up. It's because all that swelling and all that pressure on the surrounding tissues aggravates all of the tissues and doesn't feel good, right? So aside from the disc issue, aside from the stenosis or the pinched nerve, bless you, you have sort of the strained back, right? And they all have their patterns, right? And we can talk about what those patterns are. So if you're having a disc issue, it's very common that when you sit, especially if you're not sitting in sort of this really arched position, which most people don't, you typically sit in this rounded position. Imagine if the disc is bulged out towards the back onto the nerve and you sit rounded, it's like pushing on the front of that donut even harder. And that would bulge the disc further onto the nerve and thus causing more pain, right? So that's a very common pattern with disc issues. And so the reverse is true. If you look at these holes, when you stand and your back is arched, your disc tends to feel pretty good, right? Because your back is arched. But if you round forward or sit, the disc would not feel good. But the reverse is true for, it's called stenosis, where the hole is too small. When you round forward, if you look at the size of this hole right here, when I round forward, if you notice, the hole gets much bigger, right? It actually takes pressure off this nerve. But when you arch your back, the hole gets smaller, right? So you can see how for the disc, arching your back would be very therapeutic, great for you. But if you had stenosis, it would be horrible for you. As you arch your back, it's like scrunching down on the nerve even harder. And it's why, Lou, if you're standing for a long time or walking, which is a sort of arching, chest up position, why you would have more problems, right? And so there's a really important concept here, which is sometimes, you have back pain or pain down your leg, and your friend may say, oh, I had that same pain. This is what you do to relieve it. And here's the problem. If yours is from a disc and theirs is from stenosis, and they have the best intentions to help you, and they say, this is exactly what you do because this is what my physical therapist taught me, you do these exercises, right? Because I have stenosis, so you round forward, you stretch your knees up, and they feel great. And then a disc person tries to do that program, guess what happens? It hurts, right? It actually aggravates it more. Right? So this is why it's really important to understand these concepts because, one, hopefully you don't give that friend that recommendation, right? It's better just be like, oh, you should see a physical therapist. Or two, at least if you know these concepts and these patterns in the future, if your back ever hurts, you can make better decisions, right? You can almost, for example, in the future, let's say your back feels fine. In the future, your back hurts and all of a sudden you notice like when you sit for a long time, it starts to hurt or maybe the pain goes down your leg. Based on the discussion, you can say the most likely thing is the disc, right? It's not going to be stenosis. And the reverse is true. If you sit and actually feels better and alleviates the pain, but if you stand for a long time and walk, the pain goes down your leg, we know possibly it's going to be the stenosis. All right. If it's the back strain, you would know right away. It's like immediately really bad. And typically with the back strain, neither position feels good. Right? There's no sort of super favorable position. And you can test, and later on we're going to stand up and do some movements. You can see that by rounding it forward or bending back with a back strain, just like it just hurts either way. It just hurts to move it. It would be no different. Like if you just sprain your ankle, there really is no great way to move it to make it feel better. Any weight bearing on the ankle is going to hurt. Right? That's sort of how your back reacts. Right? So it's just great. Just imagine if every American knew this information, they could just make immediately better decisions if they were hurt their back, what to do best, right? Or at least they can make better decisions not only immediately, but what is the better treatment protocol that's appropriate for them, right? So that's where that comes in. And so that covers sort of some root causes of the back from a mechanical standpoint. Now we're going to talk about, many of you have had back pain on and off. And many of you haven't been to physical therapy, already understand what I just talked about, but yet the back pain still goes on and off, right? So there's something else going on, right? Aside from biomechanical. And the other thing is going to be habitual behavioral psychosocial, right? So that's the other part. So I usually tell patients, if you have a back injury, any injury, if that injury did not come from trauma, like someone took a crowbar to you, hit you with a bus, if nothing happened, like life happened, if life happened that caused your pain, then life is part of the cause, right? It's simple logic. And so if life is the cause, what that means is there are things that you're doing on a daily basis you don't realize, but those positions, those activities are actually damaging your back, right? And so, for example, I talked to a few patients this week, realizing the way they sat on the couch with legs to one side, they're like, I've been doing that my whole life. I didn't realize that's a normal thing. But to me, mechanically, that is horrible for a disc, right? Because you can imagine if the disc is pushed out, the last thing you want to do is to be in this position all the time, right? Obviously, once you understand the mechanics, you can shake your hand and be like, of course. But to that person, it's like, well, I've sat that way since I was a little kid, right? And so it's really important to kind of look at, well, what are some life things that I'm doing that is perpetuating the back pain, right? So you might be thinking, Steve, how do I know that information, right? I'm not a physical therapist. I don't understand biomechanics. I don't know anatomy, right? And so here's the way. Your body will tell you, right? And so what I mean by that is there are absolutely moments when you're in life situations that is hurting your back, because your back will tell you, like you're going to feel it. You're going to feel pressure. You're going to feel stiffness. You're going to feel something. But what we do is we go, we dismiss it, right? Because you're like, I've done that. I've done my dishes this way for the last 10 years, no big deal. But however, you might be in a not favorable position for your body. And so without being a scientist, physical therapist, clinician, and understanding biomechanics, you can essentially just listen to your body, right? And so just pay attention to the most subtle signs that your body's telling you that there's something off about this activity or this position, right? I have many patients, they'll say, I'll be like, how does it feel? They're like, it's my usual soreness when I do this, right? And I'm like, well, you shouldn't have usual soreness, especially, I mean, if you're in your 80s, maybe, right? Because there's such amount of arthritis, you may have some usual soreness. But if you're in your 20s, 30s, even 40s, I would say even 50s, you should probably not have some usual sorenesses. But we rationalize it because we've always done that, right? So specifically to this person's like a workout, like my back usually is sore after a workout. Well, something during the workout obviously is aggravating your back, but the person will rationalize it and say, that's a normal, that's okay. And that's a great example of what's really not okay. It's just you want to listen to your body and be aware of what movements during that workout routine was not favorable for your body, right? And so that's sort of a huge thing to remember. You could be nothing else take away from this presentation, this workshop, and just understand the 3 patterns and this, I guarantee your back will be healthier, right? So just listening to your body and moment to moment, it's like, what is I actually feel a little pressure down my leg, or my toes feel a little weird. Instead of just, I got to go do this thing, recognize that whatever position or activity you just did was probably not favorable for your body. And you just strategize around it. It's not like you don't do that activity, reposition, right? Listen to your body and play with your body, right? And so I think just by that approach, you can kind of figure out a lot of stuff, what's favorable and what's not favorable. All right, so that talks about the root causes. So we have 3 mechanical variables. We have strain, we have the disc issue, and we have sort of arthritis, stenosis. And then we have what we call life, right? And so life definitely factors in. So now that you understand the root causes, we can look at what's the difference between chronic versus an acute back injury, right? So the first time that you hurt your back, or the first time that you hurt anything, shoulder, neck, elbow, you have a very typical healing response, which is something gets inflamed, right? Because when you first hurt something, some cells died, something got killed. And so inflammation is the first phase of healing. That's like these enzymes that come, they kind of get rid of the dead bodies, right? They take rid of the dead cells and then get on their cell phones and they call it the next phase of healing to start, which is little baby cells come and they come to the area and then they sit around and they get nutrients and they grow up to be adult cells, right? That's the 3 phases. So inflammation, then we have little baby cells come and then they mature into adult cells. That's it. That's all healing happens in that order. And why is this important? Well, when you first strain your back, when you first hurt your back, it is very common because you feel the pressure, right? You have all this swelling, so it feels tight. Everyone wants to do what when you feel tight? You stretch, right? But stretching may not be the best thing in that time, because you would know, like for example, if you sprain your ankle and you see your ankle like boom, you wouldn't go, let me go and bend you wouldn't stretch your ankle. You would just know, like, that's not a good thing. But when it comes to back, because you don't see the swelling, because you feel the pressure, everyone's like, let me just stretch my back out. So after you first hurt your back, everyone's like, yeah, let me try to, stretch it out, and they start stretching things. That may not be a good approach. Like, you want gentle movement, like walking may be favorable because you're getting circulation to try to decrease some of that inflammation. But the last thing you want to do is to stretch it in extremes, right? And here's why. You just killed a few fibers because of too much tension, or possibly you might have just moved the disc out, which means you blew through some scar tissue, or possibly you arched too hard and you just irritated a nerve. Something got inflamed. The last thing you want to do is to put high tension through that area, right? Because the inflammation that's coming, you want rhythmic, gentle movements to get circulation going. And in the second phase, when those baby cells are healing, like a few days later, when those baby cells are coming, those baby cells are babies. They're very weak, right? And so if you put too much tension through those baby cells, you kill them, and now they're dead. And guess what happens when you have dead cells? More inflammation has to come to get rid of the dead cells, and you perpetuate this cycle, right? So very important to understand, because a lot of people right away, they feel like, I got to stretch it hard to kind of stretch out the stiffness. But what they're really feeling, a lot of it is just inflammation. Now, there are times if it's mechanical, if you're a trained clinician, for example, the disc is out, we're not stretching the back, we're using pressure in the back to move the disc back in, right? So that's different. That has a very clinical detection process and then a specific movement process to resolve that. But without being a clinician, it's safer to not try to self-diagnose and do that. So the safer thing for all sort of general population is to be safe and not stretch your back in the beginning, right? Take it easy, walk, gentle movements would be good. And so that's acute. Now, if you keep doing this to your back, if you keep perpetuating pain in your back, there's some interesting changes that happen in your body. Studies show that once you have had back pain for more than 3 months continuously, the muscles deep in your back, they start to shrink. They start to atrophy, right? And so, and also not only do they atrophy, the timing and the sequence of activation of your muscles are thrown off. Why? Because when you were in pain, you moved differently. You compensated, right? You may have braced extra in the beginning as you were moving. Once the pain was decreasing, you probably walked a little bit different. Like something about the way you move changed for a while. And after 3 months, it stayed different for a while. So you have new patterns happening in your body. And so what happens is once you're in chronic pain, it's almost like not only are their muscles weaker and smaller, but you have this error in activation and programming, right? If we were like robots and you were computers, like your code got changed, basically, right? And so that's different. And this is why people who are in chronic pain, they will try to do things that they did when the acute pain worked. Like it's almost like I did things when it first felt good, no longer feels good. The reason is the things that you're doing to try to fix chronic back pain with acute back pain strategies won't work, right? Because they're just different animals. There's different things happening, right? And so when it comes to chronic back pain, we have to actually re-educate the muscles to work properly, to stabilize your spine. And that's so much more than just strengthening. People will say you need to strengthen your core, right? And so in fitness world, that would involve, unfortunately, crunches, sit-ups, leg lifts, planks, and God knows any other, trunk strengthening stuff that's horrible for your spine. And really, it's not just strength. If you look at the studies show that when your back failed and you hurt your back, it was not from a lack of strength. It was from a lack of endurance. If you think about it, when you hurt your back ever, or when you talk to people that hurt their back, it's never from I lifted 300 pounds and my back hurt. It's usually like I did a bunch of stuff and one day I went and picked up a pencil, something light, and my back went out. It's usually not something heavy, right? And so they discovered that it's because your back endurance was so poor that at that moment, certain muscles didn't kick in and your back moved and something moved out of place or something got strained. If that's the case, then when you do your back strengthening, really the back strengthening term in public should really be changed to back endurance and skill building, because that's truly the treatment protocol. It's endurance and skill building and not strengthening. And so if that's the case, then you want to look at, well, how do we strengthen the muscles, right? And so that's all about skill building. And skill building involves getting the muscles to work properly, to synchronize properly, and not simply thinking the fitness world, which is, this is weak, let me strengthen these muscles. This is weak, let me strengthen these muscles. My hips are weak, let me strengthen my hip muscles. They sort of segment. The goal, and sure, maybe in the beginning we had to segment because of lots of pain. We had to take it easy. But the goal is to get to movements that makes all of the muscles synchronize and play well together, right? Because part of it, remember, is to reprogram the code, to get the timing and the sequencing and the activations back to normal. And to me, that is completely missing, definitely in fitness, and even in certain physical therapists, that aspect isn't being taught, right? They're just, they do bird dogs, they do some very common exercises, but they don't see it from we build one skill on top of skill. It's not simply just moving and strengthening muscles to muscles. Right? So that's sort of chronic back pain versus acute back pain. And so I have these sticks. The reason I have these sticks is because if you don't raise your hand and answer the questions, you get beat by the stick. Right? And I want to make sure I have enough sticks for that. No, but really, it's for us to test your skill level. So I'm going to hand out some sticks. Please fight the tendency to hit each other. Or if you're going to hit each other, do it with all-out force. If you're going to play hard. There you go. There you go. One for each of you guys. So you're going to stand up. This is the interactive portion. And so if you're behind the desk, what you could do is just kind of step out into this open area. You won't need too much space. And you could physically fight for it now that you have sticks. Okay. So here's what you're going to do. Yep, Mary, that's perfectly fine with that spot. So you're going to take the stick, and whichever shoulder you feel is more flexible, where you can get it behind your back, you're going to put the stick on your back like this. Whichever shoulder you feel is more flexible. And once you get the stick back there, I'll give you further instructions. Good. Okay. So the instructions are, you want to grab the stick with maybe another 4 to 5 inches below your hand, because that part of the stick should touch your tailbone / your butt. And then we'll go up from there. So that should touch your tailbone, and then your hand should touch your lower back, of course. And then your mid back, right, which is here, should touch the stick. And the last part is your head should touch the stick. Is everyone able to make all of those points of contact? Yes? Good. Okay. So when you're standing, I want you to just kind of figure out how to make all of those points of contact happen if you haven't yet. Once you have all of those points of contact, what you're going to do is you're going to slightly squeeze your shoulder blades back, slightly, just a little bit. Yep. And then you're going to just suck in your stomach a little bit and then bear down a tiny bit, like you're about to cough, right? So that feeling. Once you have your shoulder blades back, your stomach in and sort of bearing down a little bit, you're going to just bow forward 3 inches, right? Literally this far, and then come on back. And your goal is to see, can you maintain all those points of contact while you bow forward, right? And so I'll demonstrate so you guys can see, right? Maintain all those points of contact as you bow forward, right? How do you guys feel? Do you feel like the stick? And just go slowly. You can even close your eyes to feel your head, your mid-back, and your tailbone of the stick should all be touching your body. All right. So, yep. Yeah, so you want to maintain all those points of contact, right? Like who feels like you have to try kind of hard to make this happen? Yeah, right. And so here's why this test and this exercise, and you can do this at home with a broomstick. You can train with a broomstick, a Swiffer, any stick, right? And so here's why this is a pretty cool movement to practice at home. And so you can imagine if I'll do it the wrong way, like most people would do this, right? You start to round your body, right? So now you can see like my tailbone's not touching it or my mid-back's not touching it, and you go to pick something up. So my spine is in a rounded position. Versus if I'm able to maintain these points of contact and go down and pick up something like this, maintaining all points of contact, that, there's a huge difference between that versus even just, I'll do it slightly wrong, I'll try to, even this, right? So you can tell that my mid-back and my head is maybe just, probably I'm feeling maybe 2 inches forward, but my tailbone and my lower back is still touching. This is still a tremendous difference versus that. That tiny bit difference, we're talking hundreds of pounds of difference in your lower back. Hundreds of pounds, right? Hundreds of pounds. If you do this, now we can get into the thousands of pounds. Thousands, right? We're not talking like 10 pounds more, 20 pounds more, thousands of pounds more. So there's studies showing that if you were to pick up a 100-pound weight with the stick in contact, right? So if I were to just pick up, and we'll use 100 pounds, but we can mathematically figure this out because you're probably not picking 100 pounds off the floor on a regular basis, right? But if you were to pick up a 100-pound weight in this position versus that position, there's 7,000 pounds of additional pressure going down your back. That's the math. So if we just extrapolate, if it's 10 pounds instead of 100 pounds, it'd be like saying there's 700 pounds of extra pressure going down your back. That's the biomechanics. So you can imagine if you do that once, it may not be a big deal. But you do that lifelong, that's a really big deal, right? You can see how backs of 2 different people of the same age can look very different on MRIs and can be at very different levels of wear and tear or different amounts of arthritis, basically. It has everything to do with how your body and trunk is controlled as you're moving during the day, right? That's half the picture. I'll talk about the other half in a second. And so I would highly recommend that at home, take a stick, any broomstick at home, and you can simply just practice this, right? Just have a stick up your back like this, right? And see, you just start hinging in the beginning. You have to master being able to hinge like this before you add in the squat. The reason is, if you hinge, you don't have to worry about your knees and ankle. You just have to worry about your spine, right? You master this. This is a lot easier. Once you bend your knee, you have to worry about your knee and ankle. It's just more joints for your brain to control. That's our system. The system that we pioneered that we're going to share with the world is essentially how do you measure people's skill level, right? If every joint was a ball to juggle, this is only juggling your trunk, right? We'll just call that 1 ball. Once you bend your hip, now that's 2 balls. Once you bend your knee and your ankle, that's 3 and 4 balls, right? So it's just additional balls to juggle. So of course you master juggling 1, 2 balls first, then go to 3, then you go to 4, right? So you can practice the hinge, and once you have that down, then you can bend the knee and practice picking things up, right? So we can all have a seat. I want you to use a chair for a second because that's part 2. And then we're going to stand back up. Any questions on that so far? It was so straightforward, it rocked your world. You're just like, what? Good. So I just want you to sit. And I want you to sit in as best sitting posture as you can accomplish. Just want to see what that looks like. By the way, you're all being judged and graded. I'm all like, that's horrible, and that's awesome, and that's horrible. No, it is what it is, right? And so the reason I want you to, I want you to close your eyes and feel where do you feel pressure? Do you feel pressure anywhere? Do you feel pressure at the base of your neck? Do you feel pressure in your lower back? Do you feel pressure in between your shoulder blades? At the base of your head? You can just kind of shout out, right? Eyes closed, where do you feel, or you could say, I don't feel anything, it feels awesome. I don't feel any specific spots. You can shout out if you feel specific spots.
Lower back.
Lower back and knees, okay. Lower back. Between the shoulders. Neck. Between shoulders and neck. Lower back, okay. Great, so you can kind of open your eyes, come back to the world. So, yeah, if you notice, even in your best sitting posture, you can feel these spots. Right? And do you those of you that do sit for more than 30 seconds in a day, do you feel those spots at all during the day? Right. So here's some interesting things that that just happened. I had you guys sit in what you would conceptualize as the best sitting posture. And then what I did was I just tried to shut your brain down to focus on you, and you felt those spots. Do you think you're going to feel them more if you were not sitting in perfect posture? Probably more so, right? Because if you're sitting forward or hunching forward, if you felt your neck and between your shoulder blades, this would absolutely put more pressure onto your neck and your shoulder blades versus being upright, right? So it's a seesaw effect, right? So if my index finger is the middle of the seesaw, I'm going to see if I can pull this off. Awesome. So in ideal posture, this stick would be like my body. Everything's balanced, right? So if I push right over my index finger, the stick, no big deal. But if I go here and push, it's going to fall over, right? And so that's how your body works. If your body is in ideal posture from a side view, if I drew a plumb line down from my ear, through my shoulder, to my hip, through my knee, to my ankle, it ideally should be in a straight line. But the moment I do this, even a millimeter, this happens, the stick wants to fall. Obviously, you don't fall over, like you're not falling on your face, hopefully, right? And so at least not without wine. So without wine, without any assistance, the reason you don't fall over is because there's muscles behind you pulling, right? And so imagine, you can, seesaw. Like if you had a friend, if this was a seesaw, and you're standing on top of the seesaw, and you start, and there's a friend over here, like, hey friend, don't let the seesaw rock. And you start walking this way. Every single step that you go over here, your friend on this end has to push down harder and harder, right? Because there's a bigger lever, basically, in biomechanics, right? And so that's what your body does. Every millimeter that you're forward with your body, linearly, your muscles back there have to pull, or else you would just fall on your face, right? So when you're sitting, standing, in not proper posture alignment, linearly, every millimeter, if you go to 1 millimeter, let's say your muscles work this much at 1 millimeter, then 2, then 3, then 4, it's linear, right? And so as your shoulder blades and your neck and your body goes forward, your muscles linearly works harder and harder. And let's extrapolate, what does that mean? Working harder and harder means they contract more and more. They squeeze, right? That's all muscles can do. They can only squeeze. They can't like come apart, right? They come together. And so when they squeeze, guess what happens to your spine? If they're connected to your spine squeezes, right? And so that goes back to, well, what dictates how much arthritis that you get in your lifetime? There's only two variables. It's how much pressure goes through your joints, right? All your joints. In this case, we're talking about the spine, but any joint. How much pressure, how hard you push down, and how frequently you rub it, right? It's plain mechanical physics. If you push two things together really hard and rub it more frequently versus really light and not rubbing it, the two things that push hard together and rub frequently will wear out faster. That's pretty much how your joints work. And so we talked about the whole skill thing. Like if you're moving forward and allowing your spine to bend as you're picking up things, that not only increases pressure, but your spine moves. So you have high pressure and rubbing. And now we just talked about posture-wise. If your posture is sort of forward, it puts more pressure down your spine lifelong. I mean, unless you're lying down, right? Then you don't have gravity. But anytime that you're upright, it's going to put more pressure down your spine, and your spine will degenerate faster, right? So that's the effect of posture on your body. And so in posture is so important that we really feel like every human being should do posture stretches, because we talked about early on, our world is just poorly designed around this, promoting arms forward. And so unless you do something the opposite of this, which is basically this, your posture starts to go forward lifelong, right? And so we're going to do that in a second. But I just wanted everyone to feel something really interesting, which is when cued, when told to sit in your ideal posture, and then cued to listen to your body. Remember early on I said your body tells you stuff, right? Those life things, you just listen. There are some things already happening in the way your body's positioned where you felt some discomfort, right? And so that's a great example. Like sometimes I would highly recommend, maybe 2 to 3 times a day throughout the day, just pause and just listen to your body. Like, where do I feel stuff? It gives you great information, just being in tune to your body. And so the next thing we're going to do is we're going to stand back up so everyone can sort of pick an open spot. Great. And what we're going to do is just some simple movements. And so for some of you, you already know structurally, whether you've had an MRI or you have been in physical therapy, you structurally know what is the root cause. Like is it the disc, the stenosis, sometimes both? Is it a back strain? Like what was the cause of your back pain. For some of you that don't know, this sequence can help in general, pick out what may be happening, right? So all we're going to do, and there's a, you're going to answer some questions on your sheet there, but we can go through the movements first. So you're simply going to slowly, gently, don't force anything, just slowly reach down. And once you feel some pressure on the back of the thighs, you can stop and then come back up, right? So we're just going to do this. Let's just do it 5 times. Yep, and pay attention to how you feel, right? We talked about the whole listening to your body. What was it telling you? You don't have to hold it. You just kind of slowly go down and slowly come back up. We're going to repeat that 5 times. But what you want to pay attention to is, what are you feeling? Do you have back pain? Is there stiffness? Is there soreness? Is there maybe something happening in your leg, your toes, your back, down your thigh, the front of your thigh? Right, pay attention to your symptoms. And after 5, you can shout out either I felt nothing or I felt something. We'll just start with that.
Lower back.
Okay? Yes, so something, back of leg. Okay? Chrissy? Nothing. Okay. So a mix of answers. Okay? So those of you that felt something, was it pain? Or was it stretch? We'll break it down to algorithms. Pain or stretch, or both, because that is an option. Stretch, okay, Lou? Both pain and stretch? Both pain and stretch? Brenda? Just stretch. Okay, so those of you that are pain and stretch, was it pain just in the back, or did it go elsewhere? Or where was the pain?
The pain in the back of my knee and then on my back.
Got it. Okay,
My lower back.
just across the back. Okay, so what we're going to do, so those of you that have pain, you're going to do 5 more, and you're going to think about 2 things. Think about when you're going down, see if you feel stretch first, that turns into pain, or nothing, 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 and then pain, and then stretch. That's the first half of the assignment. The second half is, as you're doing it, do 5 more, and we're going to see, does the pain increase, decrease, or it's the same. So you can, both of you, just do 5.
Well, I feel my back hurts.
Right now. Okay, so we're going to see after 5 if it's increase, decrease, or the same. But as you're doing this, the second detail to pick out is, can you feel stretch with no pain before you feel pain? So we can start the first one. Can you feel stretch before pain, or is it nothing, 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 and then just pain?
So stretch and then
Got it.
and the more I did,
The more painful.
pain.
Got it. How about you, Chuck?
The more I do, the less pain I have.
Okay, right, so we can see there are some differences, right? And so one would be the more I went forward, the more painful it got, and one was actually it felt better, okay? So we'll remember those, I'll remember, but you guys can remember that response. So the next thing will be hands on your hips like this, or your butt, and then we're gonna gently arch your back, and then come forward, and we'll do that 5 times. So same thing, pay attention to what your body's telling you, pay attention to what you feel, and if you're having pain, and pay attention to, can you feel, if you do feel pain, is it nothing, 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 and then pain, or is there nothing, pressure, and then pain?
I'll be sorry tomorrow.
So those of you that have finished 5, you can call out, let's just start with pain or no pain, so we can rule out some stuff.
No pain.
No pain.
A little bit of pain, but stretch.
Okay, stretch. Okay. No pain? A little bit of pain. Okay. Pain. Okay, so those of you that did feel pain, even just within those 5 repetitions, did it feel worse as you went? Did it feel better as you went, or did it feel about the same all 5? About the same? A little bit more? Better as you went. Got it. Okay, so let's go Brenda and Mary, do 5 more, and we'll see how that feels. Yep. And so just, you can stop at light pressure. You don't have to go sort of as far as you can. Brenda, see if you can just keep your eyes on that light as you do it. And after 5, let me know, better, same, or worse, Mary.
It was a tad bit better because I wasn't going back as far.
Okay. Yep. So just because you didn't go back as far.
Right.
Got it.
Go as fast.
Okay. Do you have any discomfort anywhere aside from across your back when you did that? Like shoulder blade area? Okay. Brenda? Okay. Nice bad. Okay. We can sit down. So you can kind of fill in, you can see the ones that the questions are bolded, like what positions are tough for you, we kind of talked about in the beginning. And you can fill in what was the response when we bent forward and what was the response when you bent backwards. What's going to happen is you're going to submit the sheets back to me, and then we're going to send you additional information that may be helpful that you can use. And if you did have pain, there's that, it's got the 2 bodies, front and back. You can kind of draw in where you felt pain. And you can also draw in any artistic symbols that you would like to show me, to show off your artistic skills. I'm partial to unicorns. If you can draw one, that would be amazing. Garfield? So when you're done, you can just put your pen down so I can know who's done. Any questions? Some of you are still ready.
Okay, so with the disc pushing out the back,
Mm-hmm.
you're doing the opposite, doing the stretches, this,
Mm-hmm.
enough, does it start to...
Mm-hmm. Yeah, so the process that we use that's pretty much world renowned right now, developed by a therapist named Robin McKenzie. And so, it's been around for like 40 years. And when he first told the medical world about this, everyone doubted him. Like, he literally was tested by orthopedists that said, like, you're a quack, this doesn't work. And still this day, there are some people that say, it's kind of good. But most of us who actually read research, we know that it works. In fact, recently, we just posted a link to a published medical research on the New England Journal of Medicine, which is a very respected medical research journal. And it showed before and after MRIs of people pre and post McKenzie protocol, like this herniated, haven't treated yet, horrible looking MRI, and then this how it looks after the McKenzie protocol, and this, the after protocol, looks normal. So you can move the disc back in, right? And however, it takes a little bit more than just doing arches, right? So I always tell patients that come when we use the protocol, and I'll say things like, sure, this made it feel awesome, but this will be the easiest part of your recovery. The part that will require the most mental attention is not doing this, right? Because you could do the greatest things to put it back in, and the disc goes in, and then you sit and you round, and the disc goes out. And you stand up later and you go disc in, and then maybe you forget, you round forward, and this goes out. What happens is, imagine if I cut my finger here, if I just kept my finger still, it would bleed, it would form a scab, and after a week or two, scab would fall off and it would heal. But if I cut my finger here and every day I'm like this, guess what? The wound never closes, right? Because it never had time for the tissues to come together to heal. That's exactly what happens in your back. If you continue to do this and not round forward, that disc really never has enough time to sort of heal in a proper spot, right? And so that's what I see a lot. And so I usually tell patients it takes a lot of awkwardness in the next 2 to 4 weeks, depending upon how far the pain has gone down, for you to fully recover, right? And awkwardness means however it goes back to life, like however you used to sit, however you used to put on your shoes and socks or lift up things from the floor, you change that, right? So everything will feel awkward. Like you can't like do this to tie your shoes. You have to like keep your chest up like this, and and get to your shoes this way, right? And so just kind of changing how you live for a short period of time to an extreme of not rounding is absolutely required for that disc to heal properly, right? And that the same protocol for your neck. Like you can't look down. It's very similar mechanics. And so, those of you that know me, I'm a huge fan of balance. Now, that doesn't mean that in the spectrum of yin and yang, you stay here. No, that means sometimes you're here, and sometimes you're here, but sometimes you're here, but you kind of average out here. And what I mean by that is when you first have a disc issue and you see someone for treatment, if they know what they're doing, they should fully describe to you that in the next couple of weeks, like you just can't do this. Not forever, right? That would be impossible and not even good for your spine. But for a short period of time, you live in an extreme of no rounding. But once it heals, you can round, right? But you find a balance. You don't want to round excessively because that's what got you in trouble in the first place. You find this balance, right? So it's a great visual example of the sort of living balance. You go from extremes, but you average in the middle, and sometimes you spend time in the middle. Either end all the time is not good. The way I see it is people are spending too much on one end, which is a lot of rounding and none of this in life, and that imbalance leads to back issues, right? And so that's the general conceptual way to look at it is if you've already lived an extreme here, you need to be at this extreme for a period of time doing your therapy, and then you kind of come back towards the middle, to answer your question, right? Sure. And that's an absolutely necessary thing. And to me, from doing this for a while, all that is mental coaching, right? Because everything that I just told you could literally YouTube. Really, you could read this all online, right? But it's our job as a physical therapist to play slight psychotherapist to convince people and to really find and help them find the motivation to do what I just did visually for you, right? Because if you don't get that and you go, I'm gonna round my back again, that's why the pain will continue to do this, right? It's almost like, in other words, if we don't do a good enough job of convincing people to change life because life was what caused it, and guess what happens? Like it perpetuates. All the physical therapy, the stretching, the exercises, and all that stuff, to me, that's the easy part. It's the interesting part of changing life where you find what you need to tweak and change. That's a fascinating part to me. That's like the fun part of physical therapy, right? Because again, I tell patients, like, I could literally give you a sheet of paper that has all this stuff in it, and as long as you did this every day and followed to a T, you would be cured. But I know that most people, they don't do that. They need a little bit of coaching and mentoring and accountability, behavior modification to get, to sort of tweak those life things. And that's to me holistic physical therapy and a holistic approach to treating the back. And so hopefully after the seminar, you have a much better understanding of, what are the root causes of back? What's the difference between the 3 different categories? What's the difference between an acute back injury versus chronic back, and how skill is such an important part of recovery. And then, of course, on top of all of that, if your trauma wasn't simply from a bus fell on me, it was from life, then life needs to be looked at, right? And again, even on top of that, so how do I know what to change in life? Just listen to your body. It will tell you, right? Because we just, we looked at just closing your eyes for 10 seconds. You could just feel stuff that was there. You just didn't tap into that frequency, right? And so I feel like we are all healers. You have like a built-in physical therapist in you, right? You have built-in healing in you. And it's my job to inspire you to tap into that inner wisdom, right? Because sometimes we get a little bit busy, like, I got to do this and this and this and this, and we're not in our bodies. We're like out there in Tomorrowland. And so if you just kind of bring it back into this moment land, like, your body will tell you. You don't have to be a physical therapist. All right? Good. Hopefully that was helpful.
Yeah.
Awesome. Any questions at all from that?
So could you have a trauma and a chronic? So?
Sure. You can have a underlying chronic issue of poor motor patterns synchronizing, timing's off, muscles are atrophied, that puts your entire state at much higher risk of having these acute things. Like people who go, oh, every year or two I throw out my back, it's because the underlying code has been disrupted and never fixed. That's exactly. Great question.
When I first had my first traumatic thing,
Sure.
I was carrying tons of teacher books,
Sure.
tons of them. And so that was like the traumatic
Yep.
event.
Yep.
But also I didn't have the rest either. I
Right.
think I had both.
Sure. So to me, right, a lot of times some trauma can have started this, and people are like, well, because of that thing, I've had a bad back. The way I see it is, sure, that set it off, and maybe during the first couple months of that sort of rehab, physical therapy, if you had any physical therapy, or you just try to treat it yourself, because ultimately, if you sprain your ankle, if you just rest it long enough, it feels better. Like the pain goes away, like you heal. But the poor motor patterns that develop don't just go away naturally. And so that remains dormant, and you're mechanically at much higher risk thereafter, right? And so that's why so a lot of people will say, I've had a bad back for 15 years. And I'll be like, oh, where did it come from? They go, I know exactly. This thing fell on me, and ever since then, I've had a bad back. I'm like, well, that can't be true, right? Because our bodies heal. And so what I see it is something did trigger it, but the root cause in terms of how he or she was moving or reprogramming the body just never happened. And so there was something else underlying dormant that was never addressed. And we didn't even really talk about, it's a whole nother seminar, which is there's definitely an emotional, psychosocial component to all of this, right? Because holistically, if we look at a human, there is no mind, body, spirit, it's just human, right? And so how you feel, there's studies, I don't know if you know this, they've done studies where they just wrote different emotions on pure water, froze it, and the crystal formations were different based on what word they wrote on the bottle. They also know that certain emotions, that every emotion has specific frequencies, right? And so, of course, our thoughts and our emotions affect everything about us, right? And so there's that whole component, which would be a whole separate lecture. But yeah, so there's all that holistic. We take all that into consideration when we treat someone, mentally, physically, everything. If we had to label it into different terms. Yeah, but at the fundamentals, I see there's root patterns that have not been addressed, right? Because most, whether you get a book or physical therapy, sometimes it just goes stretching, strengthening. They forget the life behavioral and even deeper, the sort of thoughts and emotions stuff. And that's, to me, that's the future of healthcare, is addressing all of that. Right. All right? Lou, yeah?
Weight gain contribute to back pain?
Great question. Does weight gain contribute to back pain? Sure. Like we have a 20-pound weight vest over there. You can strap it on and walk around for a day. You're going to come back and be like, I hate you, Steve, because that hurts. That's the most dramatic way to answer your question. Yeah, sure. Because, right. Let's just say this. Too much pressure on your back is not healthy for your back, right? And so, of course, additional body weight is additional pressure. But so are additional worrying and burden. That's pressure. That's a very global way to look at it. Any additional pressure, too much pressure, is not serving of your health and your back especially. So you can take pressure off physically by losing weight. You could also take pressure off mentally by letting go of stuff you feel like you must do but you really don't have to do. Because trust me, 90% of stuff that you feel like you have to do, no one dies if you don't do it. So that was a very general way to answer that. I know it started with body weight, but I went to the emotionals. But that's really, because it's almost anti-holistic for me just to answer the question in terms of physical, mechanical. So, good? Awesome. Yeah. Glad you guys came.